Good morning, and thank you for joining us for the second Canadian Viral Hepatitis Elimination Day and the launch of our second report on Canada's progress toward viral hepatitis elimination. My name is Jennifer Van Genup, and I'm the Executive Director of Action Hepatitis Canada. We're a coalition of close to 80 community-based organizations holding the government accountable to the commitment Canada made to the World Health Organization to eliminate hepatitis B and C as a public health threat by 2030. We come to this work as health equity advocates to ensure that as we work toward elimination targets, we are not leaving behind people who face barriers due to geography, race, poverty, or stigma. 8 people die every day here in Canada from viral hepatitis. This is completely unnecessary given that hepatitis C is curable and hepatitis B is both preventable with a vaccine we have had for decades and can be managed with effective treatments. Action Hepatitis Canada introduced the Progress Report 2 years ago, the first report of its kind to hold decision makers accountable to make sure our prevention, testing, and treatment access policies are not only putting us on the path to elimination, but that they do so with a health equity approach. We found that while 7 provinces are currently on track to reach our 2030 targets for hepatitis C, 3 are not, and no province is on track to eliminate hepatitis B. In fact, we don't even have a good idea of how many people have hepatitis B in each province and territory. We were pleased to find 4 provinces, and as of today 5 provinces, working to put an elimination strategy in place in consultation with the hepatitis community, and 7 provinces have removed policy barriers to hepatitis C treatment access since our last report. There is still work to do, and we cannot be complacent, but it is encouraging to see the progress in policies that move toward person-centered care for people who have hepatitis C since our last report, and we hope governments will be equally receptive to the policy recommendations we have included this time for hepatitis B. Our report is available now at actionhepatitiscanada.com, and I'm going to ask Dr. Carla Coffin to expand on the ways both the federal and provincial governments can support hepatitis B elimination. Then we'll hear from Larry Wong, who was diagnosed with hepatitis B in 2004. Dr. Curtis Cooper will offer final remarks on hepatitis C, our progress to date, and next steps as we look ahead. Thank you. Carla?
Good morning. Thank you. My name is Carla Coffin, and I'm President-elect of the Canadian Association for the Study of the Liver. And I'd like to thank Jennifer and Action Hepatitis Canada for the wonderful work that they are doing to promote viral hepatitis elimination. So hepatitis B is a leading cause of end-stage liver disease and cirrhosis. It affects over 240,000 Canadians. Despite this, there is an effective vaccine for hepatitis B. Thus, it is preventable. However, there are only 5 provinces that provide the vaccine in early childhood. It is most important that we vaccinate children at birth because they are at the greatest risk of living with lifelong disease. In addition, many people living with hepatitis B are unaware of their infection. It is known to be a so-called silent killer, and we need to do more to increase screening and testing for hepatitis B. There are effective drugs that are available to prevent liver disease. I would now like to introduce Mr. Larry Wong, who will talk about his lived experience with hepatitis B and the importance of treatment. Thank you.
Hi, good morning. My name is Larry Wong. I am grateful and thankful to be a happy and healthy chronic hepatitis B patient for the past 19 years. In 2004, I was very sick, and a liver biopsy revealed stage 4 liver cirrhosis. For those who do not know cirrhosis, it is severe scarring of the liver. If the cause of cirrhosis is not managed, the liver will fail and cause death. Fortunately, I received excellent medication and care from the Toronto Western Hospital Liver Clinic. I'm now 75. I have enjoyed 10 years of productive life contributing to society and 9 years of retirement with high quality of life. I'm very fortunate that I got diagnosed early and received treatment. I wish there would be more funding and support so that more people will have access to screening, care, and treatment to enjoy a healthy life. Thank you.
Hi there, I'm Curtis Cooper, and I'm a clinician scientist at the Ottawa Hospital. I've spent the last 25 years of my career providing care for people living with chronic viral hepatitis. This includes both hepatitis B and hepatitis C. Now, these folks come from all walks of life. I see patients who are new arrivals from Canada with hepatitis B or C. My next patient will be somebody with a history of injection drug use who acquired hepatitis C that way. My population in my clinic is overrepresented with individuals from the Indigenous communities. So hepatitis C and hepatitis B affects all of us. I can help these people because we have curative therapies for hepatitis C that are safe, easy to deliver, and cure almost everybody who receives them. And I can prevent the harm caused by these viruses with treatment, and these harms include liver cancer and liver failure that nobody has to get. But the sad fact is that every day in my practice, I diagnose an additional person with liver cancer or advanced liver disease. This doesn't have to happen, but it does because currently we don't, half the people who are in Canada, over 500,000 strong, living with viral hepatitis don't know that they have it. The fact is that these are all relatively easy to solve. We already have diagnostic tests that we could apply to individuals in Canada at risk or who believe they are at risk for having been exposed, so we could diagnose them. It's not an easy, or it's not a hard task to link people once they've been diagnosed to care. We have curative therapies for Hep C, we have suppressive therapies for Hep B that protect against these horrible outcomes. But the problem is, it's not currently happening. It'll take a small investment, but more than that, it needs the direction from individuals and leadership. I would say that before we're able to eliminate viral hepatitis in Canada, we need to eliminate inertia, which we've seen for far too long. Inaction is not benign. Inaction results in more liver cancers, more liver failure, and more suffering for Canadians. So we're spending the day with people in our leadership group, MPs, people at PHAC. These are good people. They know the right path, and they also understand that these things can be easily accomplished, but we need these individuals in positions of leadership to, in the documents that are available to guide provincial health policies, we need hard, tangible, concrete, actionable items which will help identify people living with these chronic viral infections, get them engaged in the care and treatment that they require. And if we're able to do this, then I think history will judge our leaders as being on the right side of history. Thank you. And we will now take questions.
So reporters online, if you have any questions, please use the raise hand function to notify us of your questions. Si vous êtes en ligne et vous avez une question, utilisez la fonction lever la main pour nous faire part de votre question.
Great. Thank you. Thank you very much.
Thanks.